Have you ever wondered why some people over 70 walk into a routine checkup feeling completely fine and walk out weeks later, weaker dependent, or even fighting for their life? I'm Dr. Johnny, and what I'm about to tell you may go against everything you've been taught about playing it safe with your health, because the truth is, some medical tests that are meant to protect you can actually harm you if they're done at the wrong time, in the wrong way, or on the wrong body. And after 70, your body is no longer playing by the same rules. What feels like prevention can quietly become damage, and what looks like caution can turn into a life-altering mistake in a matter of hours. I've seen patients who were perfectly stable, walking, laughing, living independently, only to lose that balance after a single routine procedure they were told was harmless. And the most alarming part, many of these decisions were made with good intentions, but without the full picture. So in the next few minutes, I'm going to show you exactly which tests you need to be extremely careful with after 70, why they can become dangerous even when they seem normal, and most importantly, what you should do instead to protect your health without putting your body at risk. And I strongly urge you to stay with me, because one of these tests, especially the third one, has changed more lives in the wrong direction than most people ever realize. Let's start with something that most people believe is completely safe: a routine colonoscopy. On the surface, it sounds like one of the smartest things you can do. You're told it helps detect cancer early, that it's preventive, even life-saving. And for many younger adults, that can be true. But after the age of 70, the situation quietly changes in ways most people never fully understand. Because the real risk doesn't begin when the scope goes in, it begins the night before. To prepare for a colonoscopy, patients are required to fast and drink a powerful bowel cleansing solution. This solution works by pulling large amounts of water into the intestines, triggering repeated diarrhea to completely empty the colon. In a younger body, this is uncomfortable but manageable. In an older body, it can be a shock. You're not just cleansing the gut, you're rapidly draining fluids, electrolytes, and stability from a system that is already more fragile. Sodium and potassium, two minerals that regulate your heartbeat and muscle function, can drop quickly. Blood pressure can fall, the body becomes dehydrated, and suddenly something that was supposed to be preventive turns into a physiological stress test your body never signed up for. I once spoke with a 72-year-old man, still active, still independent, who followed every instruction perfectly. He drank the solution, stayed up all night going back and forth to the bathroom, thinking he was doing the right thing. But around 4 a.m., he became dizzy. His blood pressure dropped, and before he could react, he collapsed. He woke up not in his home, but in an emergency room. What shocked him most wasn't the fall, it was how fast everything changed. Just hours earlier, he felt fine. No symptoms, no warning signs. And yet one routine preparation pushed his body beyond its limits. And this isn't as rare as people think. Clinical observations have shown that older adults are significantly more vulnerable to dehydration and electrolyte imbalance during bowel preparation. In fact, studies suggest that complications related to colonoscopy preparation, not even the procedure itself, can increase hospital visits in elderly patients by a notable margin. And then comes the procedure. Even in experienced hands, a colonoscopy is still an invasive intervention. The colon walls in older adults are thinner, less elastic, and more susceptible to injury. While perforation is rare, the risk increases with age. And when it happens, it's not a small complication, it's a surgical emergency. But here's the part most people never talk about. It's not just the physical risk, it's the domino effect. A single abnormal finding, even something minor or harmless, can lead to more tests, more procedures, more anxiety. One step leads to another, and before long, the goal of peace of mind turns into a cycle of constant medical intervention. So you have to ask yourself a very simple but powerful question. Are you doing this because your body truly needs it? Or because you've been told that more testing is always better? Because after 70, that assumption can be dangerously misleading. And just when people begin to realize that even something as common as a colonoscopy carries hidden risks, they often turn to another test that seems more advanced, more precise, more reassuring. But what happens next is something many never connect back to that decision. But knowing this alone isn't enough, because there's another factor far more dangerous that most people completely overlook. And this is where many people make the next decision, thinking they're being even more thorough, even more careful, by choosing a CT scan with contrast. On paper, it sounds reassuring. A CT scan with contrast gives doctors a clearer, more detailed image. It highlights blood vessels, detects hidden abnormalities, and promises precision. For younger adults, the body can usually process the contrast dye without much trouble. But after 70, that same helpful substance can quietly become a serious burden. Because contrast dye doesn't just pass through your body, it has to be filtered out. And that job belongs almost entirely to your kidneys. Here's the problem. By the time you reach your 70s, your kidney function is no longer what it used to be. Even in healthy individuals, filtration capacity often drops to around 60 to 70% of its original efficiency. That means your kidneys are already working with less reserve. Now imagine suddenly introducing a dense chemical agent that demands rapid processing and elimination. It's like asking an engine that's been running for decades to suddenly operate at maximum load without warning. I remember a patient, a 75-year-old woman who lived independently, took care of her garden, and rarely visited the hospital. She went in for what she thought was a safe and advanced checkup. A CT scan with contrast was recommended just to make sure everything looked good. The scan itself was quick. She went home the same day. But within 48 hours, things began to change. She felt unusually tired. Her appetite dropped, then came swelling, and a noticeable decrease in urine. When she returned to the hospital, her lab results showed something she never expected. Her kidney function had declined sharply. From that point on, her life was no longer the same. What makes this even more concerning is that many people don't immediately connect the dots. They don't realize that what they're experiencing could be linked to a test they were told was routine. In medicine, this condition has a name: contrast-induced kidney injury, and while it doesn't happen to everyone, the risk increases significantly with age. Studies have shown that elderly patients, especially those with already reduced kidney function, face a much higher likelihood of complications after receiving contrast dye. In some cases, this damage can be temporary. In others, it can accelerate a long-term decline that might never fully recover. But the risk doesn't stop at the kidneys. Contrast agents can also trigger allergic reactions, sometimes mild like itching or nausea, but in rare cases, severe enough to affect breathing and blood pressure. And here's what many people overlook: the body at 70 doesn't always react the same way it did at 50. A substance that felt harmless years ago may not be tolerated the same way today. So the real question isn't whether a CT scan with contrast is good or bad. The real question is it necessary for your specific situation? Or are you doing it just to feel reassured? Because reassurance, when misplaced, can come at a cost your body's no longer prepared to pay. And what makes this even more dangerous is that, unlike immediate symptoms, kidney stress can develop quietly. You may not feel anything at first: no pain, no warning, just a gradual shift that only shows up when the damage is already done. That's why this decision should never be automatic. It should be intentional, informed, and carefully weighed, especially after 70. And just when people begin to realize that even advanced imaging carries hidden risks, they often turn to something that seems more physical, more direct, something that tests the heart itself under pressure. But what happens in that next test can be even more unpredictable. But knowing this alone isn't enough, because there's another factor far more dangerous that most people completely overlook. Now, just when people start to question scans and chemicals, they often turn to something that feels more natural, a test that simply checks how strong the heart really is under pressure. The cardiac stress test. It sounds logical. Walk on a treadmill, increase the speed monitor of the heart, and see if anything goes wrong. Simple, direct, even reassuring. But after 70, this test is no longer just a measurement. It becomes a challenge your body may not be prepared to handle. Because what you're really doing is forcing the heart to perform at near maximum capacity, quickly, artificially, and under controlled stress. And here's the reality: most people never hear the aging heart doesn't respond the same way it used to. With time, the heart muscle can become slightly stiff, less flexible. Blood vessels that once expanded easily may now be narrowed or less responsive. The electrical signals that control your heartbeat may not be as stable as before. So when you suddenly push this system to its limits, you're not just observing it, you're testing its breaking point. I remember a man in his mid-70s, still relatively active, who was advised to take a stress test after mentioning mild fatigue when climbing stairs. Nothing dramatic, just a precaution, they said. He stepped onto the treadmill wires attached to everything monitored. At first it felt manageable. Then the speed increased. The incline rose. His breathing changed. His heart rate climbed. And then without warning, he became dizzy. Within seconds, he lost balance and fell. Fortunately, medical staff were there. They stopped the test immediately. He didn't suffer a heart attack, but what followed was something many don't expect. For weeks after, he felt weaker, less confident, more hesitant to move the way he used to. Not because of a disease, but because of what that single moment did to his body and his mind. And this is where the hidden risk lies. It's not always about a dramatic event. It's about how the body reacts to sudden stress and how long it takes to recover afterward. Studies have shown that in older adults, the cardiovascular response to exertion is less predictable. The risk of arrhythmias, irregular heart rhythms, increases under stress, especially in those with underlying but undiagnosed conditions. Blood pressure can spike or drop unexpectedly. Balance can be compromised, and recovery time is often significantly longer than in younger individuals. But here's something even more subtle and often overlooked: the results themselves. Because the aging heart naturally undergoes changes, stress tests in older adults can sometimes show abnormalities that aren't actually dangerous in everyday life. These false positives can trigger a chain reaction: more tests, more scans, more interventions, each one adding another layer of risk. So instead of clarity, what you sometimes get is a cascade of concerned procedures and decisions that may never have been necessary in the first place. And at that point, the original goal to feel safe gets lost. So again, the question becomes critical. Are you testing your heart to understand it? Or are you pushing it into a situation it would never naturally face? Because after 70, the goal is no longer to prove how strong the body can be under pressure. It's to preserve how stable it can remain without it. And just when people begin to realize that even simple physical tests can carry unexpected consequences, they often move towards something that promises even deeper insight, something that can see everything inside the body. But what comes next is where things become even more complicated than anyone expects. But knowing this alone isn't enough, because there's another factor far more dangerous that most people completely overlook. And just when people begin to question physical stress tests, they often move towards something that sounds even more powerful, more advanced, almost like a full-body truth scan, the PET/CT scan. It's often marketed as one of the most comprehensive ways to detect disease early, especially cancer. A single scan that can see everything even before symptoms appear. And for many people, especially after 70, that promise feels incredibly reassuring. But here's what most people are not told clearly enough. This test doesn't just take pictures. It exposes your body to a significant level of radiation. A PET/CT scan combines two technologies, one that uses radioactive tracers injected into your bloodstream and another that scans your body in detail. These tracers are designed to highlight areas of high metabolic activity, places where cells are more active than usual. That sounds useful, but the problem is, not all active cells are dangerous. Inflammation, old injuries, minor infections, even normal aging processes can light up on the scan. And this is where things start to spiral. I remember a woman in her early 70s, healthy, independent, no major complaints, who decided to do a PET/CT just to be sure. The scan revealed a small, suspicious area, nothing definitive, just enough to raise concern. That single finding changed everything. Suddenly, she was no longer healthy. She became a patient under investigation. More tests followed, biopsies, appointments, weeks of waiting, nights of anxiety. And in the end, it turned out to be nothing serious, just a benign inflammatory change. But the damage wasn't physical, it was psychological. For months, she lived with the fear that something was growing inside her. Her sleep changed, her appetite dropped, her energy faded, not because of disease, but because of uncertainty. And this is one of the most underestimated risks of PET/CT scans in older adults. False positives. Studies have shown that as the body ages, the likelihood of detecting incidental findings, things that look abnormal but are not dangerous, increases significantly. And once something is detected, it's very hard to unsee it. That leads to more imaging, more invasive procedures, more exposure, more stress, and let's not forget the radiation itself. A single PET/CT scan can expose the body to radiation levels significantly higher than standard imaging. While one scan may not seem like a big deal, cumulative exposure over time, especially in a body with reduced cellular repair capacity, can become a concern. Because after 70, your body doesn't repair DNA damage the way it used to. So while the intention is to detect problems early, the reality is that sometimes we end up creating new ones, both physically and mentally. And here's the deeper question most people never ask. Are you truly finding disease? Or are you uncovering things your body has already adapted to and lived with safely? Because not everything that looks abnormal needs to be treated. And not everything that is detected needs to be chased. But once you step into that cycle, it's very hard to step out. And just when people think they've done the most advanced, most thorough check possible, they often choose one final option, something that promises comfort, no pain, no awareness during the procedure. But what comes with that comfort may carry a cost far greater than expected. But knowing this alone isn't enough, because there's another factor far more dangerous that most people completely overlook. And then comes the final choice, the one that sounds the most comfortable, the most modern, the most appealing, especially to families who don't want their loved ones to feel any discomfort at all. Sedated endoscopy, no pain, no memory. Just a quick nap and it's over. That's how it's often presented. And on the surface, it feels like the safest option. After everything you've heard so far, scans, stress tests, invasive procedures, this sounds like relief. But here's what most people don't fully realize. That quick nap is not natural sleep. It's medically induced sedation using drugs that directly affect your brain, your breathing, and your cardiovascular system. In younger patients, the body can usually process and recover from these medications relatively quickly. But after 70, the story changes in a way that's both subtle and dangerous. Because at this age, your liver and kidneys responsible for breaking down and clearing these drugs are already working at reduced capacity. That means the medication doesn't just act, it lingers. It stays in your system longer. It suppresses your breathing more deeply. It slows your reflexes. And most importantly, it affects your brain in ways that are not always immediately visible. I once followed the case of a 74-year-old woman who underwent a sedated endoscopy. The procedure itself was smooth, no complications. She woke up, spoke normally, and was discharged the same day. Everything seemed fine, but later that evening at home, something changed. She became disoriented, slightly confused. Her steps were unsteady. Her family assumed she was just tired from the procedure. But within minutes, as she walked to the bathroom, she lost balance and fell. That fall resulted in a hip fracture. And from that moment on, her life was divided into two parts before the procedure and after it. What many people don't realize is that this kind of outcome is not as rare as it should be. In older adults, sedative medications can trigger what is known as post-procedure delirium, a state of confusion, memory disturbance, and impaired awareness. Studies have shown that elderly patients are significantly more susceptible to cognitive side effects after sedation, especially when combined with underlying age-related changes in the brain. And it doesn't always end in a fall. Sometimes the effects are quieter, slower thinking, reduced alertness, changes in sleep patterns, a subtle but noticeable decline that families often struggle to explain. They say things like they haven't been the same since that procedure. And then there's the part almost no one talks about, respiratory suppression. Sedation doesn't just calm you, it slows your breathing. In a controlled medical setting, this is monitored carefully, but in an older body, even slight suppression can have ripple effects, reduced oxygen delivery, increased strain on the heart, and delayed recovery afterward. So while the promise is comfort, the trade-off may be control. You give up awareness, you give up feedback from your own body, and in return, you trust that your system will handle the impact without resistance. But after 70, the body doesn't always cooperate the way it used to, and this is where everything comes together. Because when sedation is combined with other factors like reduced kidney function and dehydration from preparation or previous exposure to contrast agents, the cumulative effect can be far greater than any single procedure alone. This isn't just about one test. It's about how each decision layers on top of the next. And suddenly, what started as a simple intention to check and be safe turns into a series of events that slowly erode independence. So before choosing comfort, you have to ask a deeper question. Is avoiding a few minutes of discomfort worth the potential cost of days, weeks, or even months of recovery? Because at this stage of life, the goal is not to eliminate every sensation. It's to protect the stability that allows you to live freely. And here's the part that very few people ever connect. Some of these decisions, especially when repeated or combined, can quietly push the body toward a point where the kidneys, the brain, and the entire system begin to lose resilience. A point where recovery becomes harder and dependence becomes closer. But knowing this alone isn't enough, because there's one final factor often ignored, rarely explained, that can ultimately determine whether your body maintains its independence or slowly begins to lose it. If you've stayed with me until this moment, I want you to understand something very important. Getting older is not about becoming weaker. It's about becoming wiser with the choices you make for your body. You don't need more tests, more procedures, or more fear. What you truly need is clarity, knowing what helps, what harms, and when to say no. Take a moment to reflect on what you've just heard. Protect your kidneys by avoiding unnecessary strain. Stay hydrated in a balanced way. Review the medications you're taking, and most importantly, always ask questions before agreeing to any procedure. Your body has carried you for decades. It deserves decisions that respect its limits, not push beyond them. If this message gave you even a small moment of awareness, I strongly encourage you to save this video. There may come a day when you or someone you love is about to make a medical decision, and this knowledge could make all the difference. And if you want to continue learning how to protect your kidneys, improve your health, and stay independent as you age, make sure to subscribe to this channel. I'll be sharing simple, practical medical insights that you can actually use in your daily life. Because at the end of the day, true health is not about chasing every test. It's about preserving your strength, your clarity, and your independence for as long as possible. And with the right knowledge, you can do exactly that. Live not just longer, but better with confidence and peace of mind.